Can I also go on a live on Facebook?
Anywhere you like, ma'am.
Yeah. Just give me a minute. I will go on live. Yeah. We are live on Facebook also. Yes, we can start the session. We are live on Facebook. Um, good evening, everyone. Thank you so much. Yeah. I just Good evening, everyone. Thank you all joining us today. Is my voice audible? Is my voice audible? Yes, is my voice audible? Yeah. Okay, great. Great. Yeah, yeah. So good evening, everyone. Thank you all for joining us today. Again, sorry for the technical issue which happened last time, that we were all eager to listen to the topic today. We've all come to the same. We going to talk about non-celiac gluten sensitivity today with Dr. Chakshu Mishra. We're going to break the myth of what gluten intolerance is, what non-celiac gluten sensitivity is. We are the second largest producer of wheat. Being the second largest producer of wheat as a country, gluten is something which is a staple. It is something which is, to us. So, in spite of having a lot of wheat production in the country, why is everyone becoming gluten intolerant or gluten sensitive? We're going to break all those myths with Dr. Mishra today. And I'm not going to waste my time talking about gluten insensitivity or gluten intolerance or anything. I will hand the mic or stage over to Dr. Mishra, and he will take over. Yes, yes, doctor.
Okay, thank you, Dr.
Thank you so much.
Reshmika. And first of all, I'll apologize for the technical glitch last time, but this time I'm all set and prepared, keeping my fingers crossed. Okay, so let's start with the session without wasting much time.
I've also given you the screen sharing option access, so you can start your screen sharing also.
Surely, ma'am.
Yeah.
I have already done that. Okay, so I'm not a hot shot basically in the field of homeopathy, but yes, this is my personal experience. So this today I'll be sharing with you a very interesting topic which we all almost every day we see one or two patients, but we really don't know what is actually non-celiac gluten sensitivity (NCGS) because in the field of medicine it is actually a new topic because it has emerged in the last 5 years only, and yes, we have been facing these patients in the last decade as well. So in India, now this has become an alarming new age scenario in the last 10 years or in the last decade since the introduction of a type of wheat in our country. Now, that type of wheat was basically introduced in order to help our farmers, but on the contrary, it is basically degrading the digestion of gluten in our body. Now, Dr. Govind Makharia, he's a professor of Department of Gastroenterology. Now, what he stated on 10th of September 2017, let me make this clear. On 10th of September 2017, he stated that in northern India, the gluten sensitivity is about 1 in 200. That means about one patient in 200 patients is suffering from gluten sensitivity. It can be celiac disease, it can be NCGS, it can be wheat allergy, it can be anything, right? So, in today's webinar, we are going to answer a number of questions. Most of some questions might have answers to you. Now, first question is what is gluten? Another will be the scientific reason behind this gluten sensitivity, the pathogenesis, what is NCGS, what are the clinical features of NCGS, and what is the right way of managing such a case, along with the homeopathic approach. And then I have a testimonial of the recently treated patient. Now, what is gluten? Okay, so basically gluten, as you can see in the image, it is basically comprised of two different kinds of proteins. One is gliadin and another is glutenin. So whenever this gliadin and glutenin, they are combined with water, that means the wheat flour is combined with water, they link together and these strands unwind, link together to form glutenin. So these are two simple proteins. One is gliadin and another is glutenin. They combine together to form a complex protein. So there is a myth among the medical fraternity also that gluten is basically a normal protein, but on the contrary, it is a complex protein. Now, the wheat flour, it comprises of 80% of starch, 10% of proteins. Now, this starch, when we talk about starch, I'm talking about the medical field, so I'll be talking about indigestible oligosaccharides. Now, these indigestible oligosaccharides are fructooligosaccharides, fructans, and galactans. When you talk about proteins, the proteins are albumin, globulin, glutenin, and gliadin. Now, glutenin and gliadin, they form together, they bind together to form gluten. So, this is a complex protein while the other proteins are albumin and globulin. Now, gluten. Gluten is basically, as I stated before, it is a composite of storage proteins termed as prolamins and glutenins. Now, basically, the gluten, that means glutenin and gliadin, they together comprise about 75 to 80% of wheat proteins. And the elasticity to dough is basically given by this gluten. Now, the complex amino acid sequences in the gluten basically leads to the resistance in the digestion. This I'll explain to you how in the later part of the webinar. And another most important question which we doctors face is what are the gluten-free Indian foods? So whenever we hear about the gluten sensitivity, the wheat allergy, the another question which arises is that what are the gluten-free foods? So if you talk about the gluten-free foods, then this is the whole list given to us by the Celiac Society of India. Like we have the grains, rice, millets, buckwheat, kuttu, rajgiri, the cholai, ramdana, corn, then vegetables, fruits, and a whole list. So this whole list are basically gluten-free Indian foods. So if you talk about if there is a patient which have come to you in for the case of wheat allergy or gluten sensitivity or celiac disease, now you have a number of options to advise. So we'll be talking about what is actually gluten sensitivity. So when you talk about gluten sensitivity, it's a condition where a patient start experiencing multiple abnormal symptoms, which are only ameliorated either after withdrawing gluten or after taking immunosuppressant medication. So this gluten sensitivity can be anything. It can be allergy, it can be celiac disease, it can be NCGS, it can be anything. We are just talking about the gluten sensitivity, that your gut is sensitive to the digestion of gluten. Now, the most important question is that why is there an alarming increase in gluten sensitivity? Dr. Rashmika has already stated in the introduction of webinar that India is the second leading producer of wheat around the world. So even after that, we have been having wheat in our meals since last many years, but still there is an alarming increase. So let's talk about the cause for it. I'll be only sharing only the research papers or the information which I have got through PubMed, nothing else. There will be nothing else. Now, this is the research paper which I got through PubMed that states the characterization of Indian wheat variety in a flat in chapati or the flatbread. Now you just see that the protein content was originally 9.7 to 15. In the wet gluten, that means after we have the dough, it was 22 to 36. This is the protein content. Now the dry gluten, that means the wheat flour, it consisted of 7.5 to 14.62. That was closely similar to the original wheat, but when it is mixed with water to form a dough, the protein content increased to about 22 to 36. So, can an increase in gluten sensitivity be attributed to an increase in gluten content of wheat as a consequence of wheat breeding? This is going to answer your question regarding why is there an alarming increase. Okay, so let's come to the basically genetics. It's a common line, the Triticum species. We have the Triticum uratu, the spiloids. Now, what basically is happening is we have first in the introduction of wheat, whenever wheat was introduced in the past decade, even after independence, we had the diploid Triticum species in India, which we usually used to grow. The problem was that it was exposed or it was not so resistant to climatic changes. Then we switched over to tetraploid wheat in the late 1970s, 1980s. So this tetraploid wheat, when it was introduced at that time, it eased our farmers in growing wheat. But even after nowadays, even you can hear in the news that there is too much of rain or there is too much of cold in the northern regions. So that also basically degrades the quality of wheat. So later in 2000 or 2010, around 2010, the hexaploid wheat was introduced, and this hexaploid species is basically the main cause of gluten sensitivity in patients in India. So let's talk about the proteome analysis of diploid, tetraploid and hexaploid wheat in order to understand the protein expression. Now the hexaploid wheat is derived from a complex hybridization procedure involving three diploid species carrying A, B and D genomes. Let's switch back to this image. Now hexaploid has basically six different genomes, or six different genomes means three diploid species. The omega gliadin, which is controlled by the beta genome in common wheat, was assumed to have evolved as a result of interaction between AA and BB. The result suggests that the expression of proteins in hexaploid wheat is not totally independent. Rather, it is a product of interaction among the diploid genomes in the hexaploid nuclear constitution. That means initially, whenever we had the diploid variety of wheat, the proteins used to express themselves through a diploid genome. Now, when we had the hexaploid and we have three diploid species in the hexaploid wheat, the product of interaction in our human body, the resistance developed in the human body is a result of that interaction among three separate diploid genomes. So this implies that the synthetic hexaploid wheat contains much more complex proteins as compared to the diploid or the tetraploid wheat, and because of these multiple interactions among diploid genomes, it is difficult to digest in our human body. So let's talk about the synthetic hexaploid wheat, which was introduced in the late 2010 or around 2000. The farming benefits are becoming hazardous for our gut because it provides new sources for yielding potential. That means the quantity of wheat, the drought tolerance, disease resistance, and nutrient use efficiency when bred conventionally with modern wheat varieties. And since its arrival, common wheat has become a more popular staple crop, not because it adapts well to different photoperiod and vernalization conditions, but also it grows more robustly than its progenitors. In addition, it has enhanced resistance to pathogens as well as versatile end products. So this all is our basically the benefits for the farmers. Now, the moral of the story was said by Dr. B.S. Ramakrishnan, the professor of gastroenterology, in an IGMR article written by him, where he stated that the evolution of varieties of wheat from diploid to hexaploid although has boosted our conventional cultivation methods, but at the same time, it is becoming difficult for our gut to digest those proteins and creating a havoc because of that abnormal interaction. Now, hexaploid wheat is more antigenic, a substance which stimulates the production of antibodies, as we know. The modern hexaploid wheat has highly antigenic glutens, which are more capable of inducing gluten sensitivity or wheat allergy. So now let's come to the point of what is the pathogenesis behind it. I hope I am audible to everyone and I am clear. Are there any questions?
Yes, doctor, you're perfectly audible.
Okay, so let's come to the pathogenesis. So just if you see a wheat kernel or just a wheat bud, you'll be able to see that there is a germ, there is a bran, there is an endosperm, as we know. And as this image shows that there are different kinds of proteins which form together to form gluten, but only when it is mixed with water. If it is not mixed with water, it doesn't form the gluten. In normal digestion, the long strands of proteins are basically broken down by digestive enzymes, and these are called as peptides, as we know. The proline and glutamine, however, are two amino acids that are difficult to digest. So, neither proline nor glutamine are classified as essential amino acids. This is the only reason. It is the high proline and glutamine content in gluten that prevents the proteins from being completely broken down by the digestive enzymes. The long-term result is the toxic oligopeptides which are present in the small intestine. Now this proline which I was talking about is degraded using an oxidase which converts fluorine into glutamic acid using glutamate gamma semialdehyde. The glutamic acid in turn must be converted to glutamine so that it can be transported to brain for the protein synthesis. Now, this is a very basic image which shows how the protein is digested, and we all know that the dietary proteins when it comes to mouth, then to stomach with the HCl and pepsin, they basically denature and hydrolyze the proteins. Then in the small intestine we have trypsin, chemotrypsin, and many other enzymes. Then after the small intestine, when we come to this intestinal lining, we have the active transport from where it is transported to brain. Now this gluten, which is a complex protein, although it is digested in the body similar to other dietary proteins, but its complex structure. So what is the complex structure? That there are three different diploid genomes present, and this complex structure makes it more prone to trigger an inflammatory response. So whenever there are any symptoms produced because of this gluten, it is obviously because of that inflammatory response triggered in our body, because of the reason that hexaploid wheat, the synthetic hexaploid newly developed wheat, has three different diploid genomes which makes it difficult to digest in our human body. So let's come to the exact pathogenesis, that what happens, that this gliadin peptide, it binds to the TLR2 receptor in the intestine that increase interleukin 1 production. After that, there is a MyD88, which is a key protein mediating release of zonulin in response to gluten ingestion. These high levels of TLR2, this causes dysbiosis. The non-protein components of wheat have been found to cause non-specific gastrointestinal symptoms. So what are those non-protein components? These are those oligosaccharides which I stated before. That was the starch. Now, this highly increased serum levels of intestinal fatty acid binding proteins in conjugation with elevated levels of soluble CD14, liposaccharides binding protein, and antibodies to bacterial LPS and flagellin. So what happens is that basically it triggers an inflammatory response, and that inflammatory response is triggered with the production of interleukin 1. So in the whole pathogenesis, the main role is of interleukin 1, which leads to the activation of those gastrointestinal or generalized symptoms. Now, gliadin peptide, it binds to TLR2 receptor that increase interleukin 1 production. The interleukin 1 alpha activates a set of immune system response processes, And this interleukin 1 alpha, what it does, it basically stimulates the fibroblast proliferation, induces the synthesis of proteases, subsequent muscle proteolysis, and release of amino acids in blood. The change in metallic ion content of blood plasma by increasing copper and decreasing zinc and iron concentration of blood. So whenever you have a patient of celiac disease or wheat sensitivity, gluten sensitivity, or gluten allergy, you will find that the hemoglobin level of the patient is to a level, you can say either it is normal or it is below normal levels. You cannot say state it as an anemia, but you will find it below the normal levels. Then there is an increase in blood neutrophils. This you'll find in the CBC. And there is an activated lymphocyte proliferation which induces fever. So this fever can be a low grade fever or it can be a high grade fever. But in India, because we have been constantly eating wheat since our childhood, this fever which is induced after gluten sensitivity is usually a low grade fever. So let's come to the intensity of diseases. So what this gluten sensitivity actually causes in India. So there's a huge, it's a whole lot of graph. So first of all, in the minor symptoms, we'll get the irritable bowel syndrome. Now you see, irritable bowel syndrome, we homeopaths, obviously we consider it as psychosomatic because there are psychological symptoms associated with it. But yes, when you talk about the pathology, then the IBS has some or the other relationship with that wheat sensitivity. Now on the second level, we have the NCGS, the non-celiac gluten sensitivity, then we have the gluten allergy, and then the celiac disease. So this is the whole level of intensity of diseases which is caused or which basically occurs after that gluten sensitivity in our body. So now we are going to talk about the NCGS or the non-celiac gluten sensitivity, which is the main topic of today's webinar. So am I clear up till now? Are there any questions to answer? I hope I am clear to everyone.
Yes, yes,
Okay,
doctor, you're absolutely clear. If anyone wants to type and ask questions, they can type in the chat box
surely, ma'am.
and they can ask, and I would definitely address the question to you, doctor.
Surely, ma'am. Surely, ma'am. So
Thank
now
you.
let's talk about NCGS and what is actually NCGS. NCGS is a syndrome in which people develop a variety of intestinal or extra-intestinal symptoms responsive to the withdrawal of gluten-containing food from the diet after celiac disease and wheat allergy are excluded. So if we have a patient of wheat sensitivity, just see the graph that we have excluded the gluten allergy, which is basically a very acute reaction and it is basically a higher grade reaction. Then we have excluded the celiac disease. That means the symptoms which are arising from a more number of days or from a larger interval. And whenever we have excluded these two things, and if a patient is responding to that wheat removal from his diet, then we can say that the patient is suffering from NCGS. Now, the NCGS may be immune mediated, now appears to be more common than celiac disease in India, with a prevalence estimated to be 6 to 10 times higher. Now, let me make one thing clear. This basically prevalence of NCGS is different in different parts of the country. If you talk about the research papers, if you read about the research papers, you'll find that the NCGS is more common in northern and eastern parts of the country rather than the southern parts of the country. Now let's come to the special points considering it equally important to celiac disease. First is that the prevalence of NCGS is now prevalence of 0.5 to 13% in general population. I'm talking about India. There are no biomarkers available for the disease till now. Or the only thing which we know is that if we are excluding the celiac and wheat allergy from the patient's diagnosis, and then we are ruling out the wheat intake from his diet, then the patient is feeling better from that withdrawal of wheat. That means the patient is suffering from NCGS. Otherwise, there are no exact biomarkers available. Therefore, many patients suffer symptoms that might be interpreted as IBS for years. FODMAPs, as I talked about, that oligosaccharides, the fermentable oligosaccharides, disaccharides, they are present in gluten-containing grains, have been identified as a possible cause of GI symptoms in people with NCGS. Another, that in India, the prevalence varies from 1.23% in northern India to 0.13% in southern India, as I stated before. Furthermore, the true prevalence is still unknown because GFD has emerged as a new dietary trend. GFD means gluten-free foods. Most of the times it was not available before, but since in the last 5 years, because of those advancements in our community, we have a lot number of foods which are gluten-free right now. Although NCGS can occur in any age group, but adults are more prone to it, and the median age of onset is 40 years. Experts agree that NCGS displays the iceberg phenomenon, and the prevalence has increased over the past 2 decades, estimated to be between 1 in 100 and 1 in 300 as per the ICMR task report of 2014. So what are the clinical features of patients which are responsive to a gluten-free diet? Now, let's talk about the intestinal symptoms first, which are bloating and abdominal pain. There can be diarrhea, epigastric pain, nausea, arophagia, GER, and alternating bowel habits. Other symptoms can be tiredness, aphthous stomatitis. You'll find, in my practice, I have find more than 100 cases of NCGS till date, and maximum cases in my area were suffering from this aphthous stomatitis, and they basically responded to homeopathic medicines really well after I excluded that gluten from their diet. Now we have headache, anxiety, foggy mind, numbness, and a hell number of symptoms. Now the gastrointestinal symptoms, as stated before, had abdominal pain, bloating, altered bowel habits, nausea, flatulence, GERD, aphthous stomatitis. Extraintestinal, headache, fatigue, fibromyalgia. Now, fibromyalgia is also considered to be psychosomatic, but in the research in India by ICMR, it is found that fibromyalgia may also be a result of NCGS. There can be leg or arm numbness, tingling, dermatitis, and above 20% of people have IgE mediated allergy to one or more inhalants. It may, if it is an allergy to wheat, it will be wheat allergy. But if it is NCGS, then it will be a mediated IgE mediated allergies to other inhalants. Now, 35% of patients suffer from other food intolerances, mainly lactose intolerance. Now, in India, lactose intolerance is also becoming very much common. So, NCGS must be compared with other diseases as well. So, we have celiac disease, the wheat allergy, and the non-celiac gluten sensitivity. I have utilized my homeopathic knowledge as well in performing this tabular presentation. So if you talk about celiac disease, it is considered to be autoimmune. Wheat allergy, obviously it's an hypersensitive immune response. And NCGS, it is an idiosyncratic reaction. The gluten elimination is the only option in celiac disease. Gluten is an allergen, so it has to be avoided in wheat allergy. And in NCGS, the patient progressively responds to gluten elimination. What are the causes? They can be genetic predisposition, stress, trauma, viral infections, and other. Now, it is a completely IgE mediated immune response, and NCGS may have an innate immune component, but it has to be established. Still, it has to be established because we do not have any biomarkers available till date. Now, there are over 200 identified symptoms of celiac disease. We know that there is a hell lot of number of symptoms. And the wheat allergy, since it is an IgE mediated immune response, it will be very similar to other allergies. There will be nausea, abdominal pain, itching, urticaria, and all. Now, as I have stated before, that there are very common symptoms of NCGS, and these common symptoms are very much similar to IBS also. Now, these symptoms, as I have stated, in celiac disease, there is failure to thrive, weight loss, delayed puberty, iron deficiency anemia, dyspeptic symptoms. Now, this iron deficiency anemia, as stated, I have already mentioned before, that since there is a decrease in the iron content in the body because of that immunoglobulin E reaction, so that is why there is an iron deficiency anemia. Then there is also recurrent aphthous source in celiac disease, but celiac disease has other ways of confirming. Now IBS. IBS, we have abdominal pain, cramping or bloating, typically relieved by passing a bowel movement, excessive gas, diarrhea or constipation, sometimes alternating bouts of diarrhea and constipation, and then mucus. These are the basic symptoms of IBS, and these symptoms are very much similar to NCGS also, where there is bloating and abdominal pain. Then there will be diarrhea, there will be altered bowel habits, then there will be epigastric pain, nausea, aerophagia, GERD, and aphthous stomatitis. Now, how do you differentiate between all of these? The only criteria we have available till date is that we have to exclude gluten from the diet. If a patient is responding to that gluten removal from his diet, that means the patient is suffering from NCGS. If the patient is not responding to it, then there may be some other causes as well. Now, celiac disease is autoimmune. Irritable bowel syndrome, IBS, is considered to be psychosomatic, and NCGS, as stated before, it's an idiosyncratic reaction. Now, the most important point is how do you manage such a case, and in fact, what is the right way? So, as stated by ICMR, we have a four-step model. Number one is elimination, that we have to eliminate gluten from the diet. Then we have to analyze. Then we have to evaluate, and as per the patient's response, then we have to include it in the diet. Now, elimination, as stated before, we have to prioritize it. We have to look for alternate sources or overcooked less gluten foods. We have to keep a close watch on milk and milk products, because as stated before, they sometimes the patients can also suffer from symptoms which are lactose intolerant. Then, even after elimination, if a patient is experiencing symptoms which are aggravated by any other food, that too should be limited. No further addition of any aggravating food item should be strictly monitored. Now, recording, it's a very similar way how we record the patients, that the recording of symptoms should be done by patient or the caretaker. Every symptom must be noted down. It should be recorded chronologically. The analysis should be keenly done by caretaker or the physician, and every symptom matters. Now, the analysis will basically ascertain the intensity of sensitivity along with the details of the complaint. Evaluation, it includes symptoms perceived after gluten elimination, details of analysis of symptoms of patient. The complete plan of treatment, including the prognosis of case, can be ascertained by similar evaluation with every follow-up. That means with every follow-up the patient is coming, we have to basically evaluate the symptoms perceived after gluten elimination and then details of analysis. Now, this is the whole set of diagram. Now, first is GFD, means gluten-free diet. A can be gluten or it can be a placebo. Then B2 can be a gluten or a placebo. Now, first what we do is we start the gluten-free diet and we eliminate that gluten from the food. We keep on eliminating it, and then we see how the patient is responding to it. If the patient is responding and if the patient is showing signs of improvement after 6 weeks of GFD, that means gluten-free diet, then we can include a gluten product in the diet. Then again, if the patient is showing signs of improvement, we'll keep on including that. If the patient is not showing any signs of improvement, that means that we have to keep the patient on a gluten-free food. So this is how the whole process goes on. It can be it is a lengthy procedure. It can range from 6 weeks to about 9 weeks, or in fact even more. Now, the inclusion of gluten in diet. This is the most careful step. How do you include gluten in diet? The physician has to include gluten slowly, keeping in mind the rate of reaction. This we'll get to know from the evaluation and the analysis. The inclusion must be slowly progressive, and the quality of gluten-rich food should be the considerable factor. That the quality and the quantity must be regularly checked if you are including the gluten in the diet. The whole three above mentioned steps must be repeated every time the quantity of gluten-rich food is included. Every symptom of patient decides the quantity and quality, and the inclusion should be selective. So, am I clear till now? Do we have any questions, Dr. Rashmika?
No, doctor, no, we don't have any questions. We're taking in the whole lecture.
Is the topic too lengthy or is it not
No, no,
interesting?
no, no, absolutely not. Absolutely not. I think you're making it more clear and detailed. I think it's broken down it into a very simple manner. I think
Right, exactly.
we've
Okay,
always been, yeah.
thank you so much. Now let's talk about the homeopathic approach. How do you, what is should be the approach of treatment in such cases homeopathically? Now, the first is case taking, obviously. Then we have to evaluate, then the prescription, and then the follow up. This is a very common thing. So, what we have to take into consideration. So, first of all, we should get the maximum presenting complaints, and our focus should be in perceiving those presenting complaints of the patient. Now, we have to organize them chronologically, as mentioned before. Then, our focus should be on presenting complaint in the form of complete symptoms in every follow-up. Now, there may be a lot number of associated as well as concomitant symptoms also. So, what we are doing is we are basically trying to include as number of symptoms as we can because NCGS shows a number of symptoms. So, there might be a few general symptoms, but it is often found that those general symptoms are modalities. Mental generals plus physical generals will guide us to the individuality, no doubt. But our focus should be on the presenting complaint as well. Now, the severity of an affection of patient as presenting complaints, it cannot be left aside. Now, this miasmatic evaluation, or this is this actually I have not published any research paper till now regarding the number of cases I had, but this is the miasmatic evaluation, which I basically this is my personal opinion that the number of patients which came to me were they were either psychotic or they were syphilitic. I could find only a few patients which were tubercular, a few which were soric, and a few which were psychosyphilitic. But most of the patients were either psychotic or syphilitic or psychosyphilitic. This is the miasmatic evaluation. Whenever you are searching for the number of remedies in order to treat a patient of wheat sensitivity. Now, if you come to the direct sources, we have a rubric in the Murphy's repertory which says the wheat general aggravation. Now, we have a number of medicines including Berberis vulgaris, Copaiba, Lyco, Nitramute, Nitram Sulf, and many more. Another, if you talk about the indirect sources of bread aggravation, then you will find bread aggravation in generalities that will be Brineia and Pulsatilla. Now, I have basically made this reporterization much easier. So, in order to make you understand, we have the indirect source of bread aggravation from different repertories from Kent, BBCR, BTPV, and FATAX repertory. Whenever when I used this particular rubric from different repertories, I found five remedies common, which were Brineia, Pulsatilla, Nuts vomica, sulfur, and Natramure. Okay, as stated before, as I have already explained before, that the gluten sensitivity is basically a reaction of two different kinds of proteins which combine together to form gluten, right? So a bread is formed only when that flour is mixed with water to form a dough, right? So exact rubric, if you are trying to find out from repertory, it will be the bread aggravation, but that does not mean that the patient is sensitive to bread intake. So that is why we have a direct rubric also. But the problem is we cannot rely on any of these rubrics in any way. Yes, we can use this rubric as an eliminative rubric in our reporterization, but that never means that this rubric is authentic. So what should be the plan of selection of remedy? This is going to be an interesting topic now for us homeopaths. So what should be the plan of selection of homeopathic remedy? Firstly, we have to analyze the prognosis of the case. Second, we need to cure the idiosyncratic reaction of the patient. That means what we are treating is the sensitivity of the patient, and we are not trying to treat his presenting complaints. But the remedy which we are trying to find out must include those presenting complaints, because we have to give relief to the patient, right? This is our whole this is our sole motto. What we need for this, we need a miasmatic prescription or a constitutional prescription. But at the same time, the patient wants to get rid of his presenting complaints, so this is what we should do. The first prescription should be the miasmatic prescription. Why? Because we are trying to treat the idiosyncratic reaction of the patient, so we are focusing on the miasmatic prescription. And as I have stated before, I'll be coming back to the graphical analysis, which states that the maximum of the patients which I basically treated were either psychotic, syphilitic, or they were psychosyphilitic. So what we are doing is, we are basically trying to first we are trying to prescribe a miasmatic prescription in the first prescription, and then accordingly in the further follow-ups, our second prescription should be based on totality of symptoms and plus the prognosis. So now prognosis is very important. We'll have to analyze what are we going to treat and how are we going to progress in this case. Are we trying to cure the case, or are we trying to palliate the symptoms, or are we trying to suppress the condition? This we have to analyze on the basis of the symptomatology or the presenting complaints of the patient. Because I should say this, there may be many seniors here and many juniors as well, but this is my personal opinion that as a homeopathic doctor in this present scenario, we cannot guide our patient to the curative phase every time. We'll have to analyze, we'll have to reanalyze again and again in any follow-up in order to check out what are we trying to treat. Either we are trying to palliate the symptoms or we should try to suppress the condition. Now this should be completely based on the patient's presenting symptom. Now I have a case, and this case will be basically the testimonial of the patient, because we do not have any biological markers available. Now, this is a very recent case which I experienced, which I saw during the lockdown. And this lady was 42 years old. She was a housewife. She complained of cracked, sensitive, burning sensation and painful tongue since last 10 years. Now, you imagine we have a patient which is a villager, and she is suffering from this condition since last 10 years. She has not she could not get any relief from any of the doctors. She was on bland diet, no spices, no chilies, no flavoring since last 10 years. Can you imagine a patient who is a villager? She's not having any spices, she's not having any chilies, because she's suffering from that cracked, sensitive, burning sensation in the tongue. And she could only tolerate the salty food. Her burning sensation was only ameliorated with hot drinks, especially tea. After second follow-up, she revealed about her complaints of pain in abdomen and rectum. She never felt satisfied with her bowels. After constant inquiring about ailments from, now this is how I treat a patient. Now ailments from for me are very important if I am treating such a complicated case. Now, while I was during the follow-up, she basically told me that she was disappointed with the norms of consolidation of government. Now in villages, we have particular norms. We have a consolidation officer, which basically leads to the consolidation of different farming lands. Now this was improper. This made her sad. She opposed it everywhere. She filed a case in the district court but lost it. And slowly she started becoming indifferent to everyone. Now, in this case, the patient could have shown a very aggressive reaction. Right, this is very much common. That, for example, I have a farming land. I have been farming the land for last 4 or 5 years, or 3 or 4 years. Now suddenly a consolidation officer comes and he says that this land does not belong to you as per the consolidation norms. So I should be really angry. But now here the reaction of the lady was that she was disappointed. What are those norms? Why are they doing so? This made her sad. She opposed it, and she basically used the way which should be very lawful. She filed a case and she lost it. The patient was neither introvert nor very expressive, but was anxious about her health. Since she was suffering from this condition since last 10 years, so she was anxious. Her constant illness, failure from getting relief created a feeling of loathing of life. She felt it as a burden, and this feeling increased every time she was about to defecate. Whenever she was trying, she was going to defecation, she felt this feeling increased. She has been constantly bearing it since last 10 years without much chaos, even after being disappointed by the results of constant treatment. Now, this was the picture of the tongue. Now, this picture I clicked it on 15th of March 2020. Now you can see that the edges were completely red. It was really painful for the patient. There were a number of cracks on the sides. I could not get a picture of that. Now, as you can see, there were cracks here. There were cracks at the back. There were these prints. These were the prints of the teeth, and on even the tip of the tongue, it was similarly red. Now, what were the presenting complaints? First was aphthous in the mouth, then pain in the tongue, which was burning. Her tongue was sensitive, it was bleeding, the discoloration was red. On the follow-ups, I found that there were complaints of flatulence before a stool. There was pain while defecation, that was cramping in nature. It aggravated during defecation. The stool was black and the constipation was painful. Then the mental and physical generals, she was disappointed, there was loathing of life, there was indifference, anxiety, fear of death, and anxious about her health. Her thirst, she had unquenchable thirst. Because of that burning sensation, she used to drink about 3 to 4 liters of water per day, that even during the time of winters. Because while although that warm drinks used to ameliorate her complaints, but still she used to drink that much of water, even if the water could not give her much amelioration. So this is very important symptom. A patient is basically experiencing pain and burning in the tongue, but she is having so much of water, still that water is not ameliorating her complaints. Instead of that, the warm drinks or the warm water or the warm tea is basically ameliorating those symptoms. Now the spices, it aggravated it. Now even eating after, there was eating after aggravation. There she was not having any appetite. That appetite was relished without, because she could not experience any sort of spices or any sort of much salt or any seasoning. Now there was sleeplessness from the pain. The pain, now this I have not utilized this sleeplessness in any other symptom because it was a general symptom. The sleeplessness was either because of pain in rectum or either because of pain in tongue, but there was sleeplessness every time. Now the perspiration, there was staining the linen, and then perspiration was after a stool. So this is the reporterization chart. So before showing you the reporterization, let me ask you one more time. Are there any questions this time?
Yes, yes, doctor. Yes, Professor Dr. Akhilesh Kawan has asked that this non-celiac gluten sensitivity disorders are producing o
Okay,
producing o
I'm reading it, ma'am. I'm reading
yeah,
it that it is
you
owing to the intake
owing
of
to the
genetically engineered foods like wheat. So if the intake of these foods are stopped, what would be the condition of a SAD patient? Example, the SAD condition of NCGS will
NCGs.
automatically. Yeah, obviously, sir. NCGS has no biological markers, to be really honest, and every patient of NCGS responds to wheat removal from his diet. If you are removing wheat from the diet, every patient responds. Do we have any further questions before I come to the reporterization? No.
How much is an inclusion like end after the fourth step? You said that inclusion of wheat again slowly is necessary.
Yeah,
When is the
I'll
inclusion necessary?
I'll tell you. I'll tell you further. I'll tell you further after the case is finished.
Yes, sure,
Okay.
definitely.
Okay. Let me finish the case first.
Yes, sure.
Now this is the reporterization of the patient. Now we have a number of symptoms. There were about 24 symptoms. We have a number of remedies, including the Merc salt, arsenic, phosphorus, nux, lachesis. So these all symptoms, when I repertorized through the synthesis, I found all these remedies. Now here I have not included the rubric of wheat aggravation or bread aggravation. As you can see in the whole repertorization, I have not utilized it. My focus was to treat this patient homeopathically. So I have not utilized that rubric anywhere. The first prescription was Thuja because the patient was found to be psychotic. I have a habit of prescribing biochemics. So this was the combination of biochemics which I gave, which included MacPhos, Calcarea fluor, Ferrum phos, Natrum sulf, and 6x. I'll be really honest. I obviously prescribe multiple remedies, but my every multiple prescription has different set of potencies in it. So the first prescription was Thuja occidentalis and preferred with placebo. Now, after this first prescription, this was the first follow-up. That the burning sensation of tongue, it aggravated. The apathy and bleeding, it aggravated. Anxiety had no improvement. Bowels showed no change. She started perspiring more. That means everything was aggravated. Now, this, if a patient who has been suffering from last 10 years, he comes to you, you prescribe a remedy homeopathically, you prescribe a miasmatic prescription, and you find an aggravation in symptoms. So this might be a very easy sign, or might be a happy sign for us homeopaths, but still this was a more devastating sign for the patient. She said that, what have you done, what have you given me, this is basically aggravated. I had to console her a number of times, before giving the second prescription. Now the second prescription was Merck Sol 0 by 1. I am a millisimal prescriber. I usually use millisimal potencies. I utilized that Merck Sol in 0 by 1, and I gave Terexicum. Now Terexicum was given on the basis of these presenting complaints, especially of the tongue, that there was apathy in the tongue, there was burning pain, the tongue was sensitive, then there was bleeding in the tongue, right? So I prescribed Terexicum just on the basis of presenting complaints because she was so much furious. I had to give her something in order to ameliorate that. Now, Merxol was given 3 times a day, Terexicum was given 2 times a day, and biocombination was given 2 times a day. Now, this is the as you can see, this is the complete tabulation. Okay, just now, as you can see, we have the first prescription was given way back. Now, on 20th of March 2020, she came back to me when I prescribed her Merxol 0 by 1. The tongue sensitivity, it showed no sign. The burning sensation, as I told before, before prescription or before prescribing Merxol, there was increase. Then stool character was black. She was constipated, and I prescribed her Merxol 0 by 1. Now, after this prescription of Merxol 0 by 1, when she came back on 31st of April, she was 10% better with the tongue sensitivity. The burning sensation was better. Apathy was better. Flatulence was better. Abdominal pain was better. That means my prescription was correct. So I switched over to Merxol 0 by 2. Now, Merxol 0 by 2 on 28th of May. Now, this is a huge gap in between because during that period it was locked down. Still, I had to call the patient every month in order to visit me, and even I basically I continued my clinical practice even during lockdown, although it was just for 2 hours. Now, on 28th of May, she was 20% better. The burning sensation was better. The apathy were better. Flatulence was better. Abdominal pain was better. Then I prescribed Merxol 0 by 3. I kept, this is my habit, and this is Dr. R.P. Patel sir's instruction as well. If a patient is responding, keep on increasing the potency in millisimal scale prescription. Now, this was 27th of June. She was much better, but still there was some bloody mucus, nevertheless, but she was quite much better in maximum of her complaints. So this was the time when I included that gluten in her diet. Now the question was, why to include? If a patient is responding to medicines, she till this time, till from 20th of March till 27th of June, she was on gluten free diet. During this period, she had not even taken a single chapati. She was on rice or she was on barley. or she was on many other things, but I had to give her a complete set of foods in order to make her understand you have to take all these foods, but you will have to exclude that wheat. Now this during this period was very difficult for me when she came on 31st of March, no, 31st of April, because till this period she had not taken a single chapati, and since she was feeling better, so it made her understand that wheat was basically causing the symptoms, so she kept on excluding it from the diet. Now this time when she was very much better on 27th of June, I had to make her understand that yes, we will include wheat in your diet. The only reason I gave her was you cannot live without wheat throughout your life, because it is a staple crop of India. You have your own fields, you grow wheat every year, so you cannot keep yourself away from wheat. So I had to make her understand. Now on this, yes, you can see even after inclusion of diet, she was feeling much better on 19th of July. Although there was sudden flaring of apathy, then there was aggravation in the flatulence, there was episodic pain, there was bloody mucus, constipated. So all these symptoms came back. Before that, the patient was much better. Things were much better. The tongue sensitivity was better. Everything was better. But suddenly, after the inclusion of wheat, these symptoms suddenly flared up. And then again, I continue. Now, this time she was on gluten inclusion diet just for once in a day. That means even in the afternoon, she used to have two chapatis only, and those two chapatis caused all these symptoms. Now, on 4th of August, as you can see, now 18th of August, now this time also, here what basically happened was that on 4th of August, she came to me, she said that the tongue flaring and the tongue apathy, they are better, but the flatulence, it is almost negligible. Still there are episodes of pain, still there is a sticky stool, still there is, she is constipated. And then, so I had to convince her, okay, this time I'll see you after 15 days. So after 15 days, she was quite much better, even after gluten inclusion. And then on 1st of this month, she again came back to me. She was much more better. But still, since the patient was responding to medicine, so I had to increase from Merxol 0 by 1 to 0 by 2, 0 by 3, then 6, then 0 by 12, 0 by 24, 0 by 30, and now she is on 0 by 60. Okay, so here was the prescription. First of all, I gave Merxo 0 by 1 three times a day. Then again 0 by 2 was continued three times a day. We have a question here, I feel like.
Yes, doctor. Yes, it's a continuation. So, if the NCGS are automatically removed from, after withdrawal of the said genetically engineered foods, so how will it be miasmatic? How will it be a miasmatic disease? It would come under inappropriately named chronic disease as mentioned in aphorism 77 of Organon Medicine.
Okay, sir. Okay, Dr. Khan, as you have written so much, just give me a moment to read it. Now, NCGS are automatically, if the NCGS are automatically removed after withdrawal of said genetically engineered foods, so how would it be a miasmatic disease? Sir, it is a basically, it's an acute miasmatic disease. No, it is not a chronic miasmatic disease because the patient obviously responds to gluten-free diet. So it is the sensitivity of the patient which we are treating. We are not treating NCGS actually. We are treating the sensitivity. It can be mental sensitivity, it can be physical sensitivity. But the signs which we get here are signs of physical sensitivity. Now, here you can see I prescribed Merxol in a way that Merxol 0 by 1 to 0 by 3 was given three times a day. Merxol 0 by 6 was given twice a day. Merxol 0 by 12 was given once a day. 0 by 24 was given once in 3 days. 0 by 30 was given once in 7 days. And now 0 by 60 is given once in 15 days. So this is how I prescribed Merxol in the millisimal scale here. Okay, so here she was a gluten-free diet. The gluten-free diet was continued till 27th of June. Now on 27th of June, the gluten inclusion was administered. It was continued and it is still continuing now. So this was when she first visited me on 15th of March, and now when she came to me on 1st of this month, you can see the changes in the tongue. It is the same patient and you can see the changes in the tongue. Okay, now let me come to the testimonial first. I hope it is audible to everyone. Dr. Rashmika?
Doctor, please play it. I'll.
Okay, okay, just let me know, ma'am. I'll pay.
Yeah. No, it is not much audible.
Hi, ma'am.
It's
Hello.
not audible. It's not audible.
It's not completely audible.
No, it's not completely
Can
audible.
you see? Can you see what is written?
Yes, yes, yes. That's
Okay, okay.
perfect.
I'll continue with that, ma'am. I'll continue with that. Now you see, as Dr. Rashmika is saying, it is not audible. But as you can see with the testimonial of the patient, that she was suffering from this condition since last 10 years. She was not able to eat the normal food as prepared in the home for others. But now, during my treatment, she was able to eat that normal food, although the tongue was still sensitive. But now, this time, she was able to eat it properly, which she never used to have before since last 10 years. So this is the first testimonial when she was under my treatment. She was basically during the treatment. Now this comes to another. Let me play it for you. Uh, okay, so this is on first of this month. Now this video is when she came to me on first of this month. Ma'am, is it audible now or not?
Yes, this is audible. This is audible.
This is audible, ma'am.
Yes.
Okay, I hope there is no problem with Hindi.
I hope not, but I think people are there from outside India also.
Okay, okay,
So
I'll explain to them.
yeah,
I'll
sure.
explain to them.
Thank you. Thank you.
Now here the patient is saying that the medicine was started round about February, but it was actually March, and since then the patient started having my medicines. Now the patient, as I have asked the patient, that today is 1st of September. On 1st of September, if you have to rate the improvement in yourself out of 100, the patient is saying that she is experiencing more than 50% improvement in all of her complaints. Now, till now, the patient is having the wheat chapatis once in a day. As per what I have stated her to take, the number of chapatis are either two or either three as per her hunger. Now, as I have stated her, if she is having wheat once in a day, she is feeling very much better. But if someday or the other, as per her convenience, if she is taking wheat twice or thrice in a day, then there is sudden aggravation or very mild aggravation in her complaints. Now, as you can see that I have asked the patient about her symptoms. She is saying that the tongue soreness, that pain in the tongue, the burning sensation, they are much better. Only now, right now there is very light dryness. If she is taking wheat once in a day, then there are no complaints as such. But if she someday or the other, if she is taking wheat twice or thrice in a day, then there is very mild aggravation in her complaints. So I'll be coming back to uh, here.
Yes, doctor. There's another question by Linda Woods. The historic method of soaking and fermenting grains can help with sensitivity. Using Encorn wheat and fermented sourdough can also help. Do you have a comment?
Ma'am, still, what since we are regularly having patients of gluten sensitivity in our clinics right now, even in northern India, if you know about NCGS, if you know how to diagnose NCGS, then you have a number of you can see a number of patients in your clinic. So what we usually do is that we usually ask the patients to soak, as you are telling me, to soak the grains, but if you are having wheat, then first you'll have to soak it, then you'll have to dry it in sunlight, and then you to make that flour. But still, it is basically the gluten which is affecting. So whenever flour is mixed with water, it again forms gluten, and then gluten is basically affecting her. So what we are trying to help her is we are trying to treat her sensitivity. So as per what the testimonial says, that the sensitivity is now much better after she has come to my treatment, and it has helped her accordingly. Now the question of Dr. Professor Khan is how it will come under acute miasm. Acute miasms come under acute infectious conditions. Sir, I'm really sorry. My knowledge of organon is not that good, to be really honest. But if you can see the testimonial of the patient, my way of prescription and my way of diagnosis, if it is helping a patient, if she is getting cured, that means I am on the right track. What we are treating is we are treating the sensitivity. The sensitivity is getting ameliorated, things are getting ameliorated, and in a way, whenever you are helping these patients, what is more important is the result, not how you get those results. But still I am trying, what I try and what I always do is I try to prescribe classically, but as per those commercial things, although I use a number of remedies as well, but still in this case what I used was just Merxol and just Terexicum and nothing else. And till date the patient is much better, sir. IgE levels, let me make one thing very clear, sir. The patient came to me when there was lockdown. I asked her to get the IgE reports. She had those IgE reports when she used to visit a Delhi based hospital, but IgE levels were completely normal. There was no sensitivity seen in the IgE levels, and only she had what she had was the quantitative analysis of IgE, not the qualitative analysis. So I never had any copy of those reports which states that she is allergic to wheat. So I had to take this case as a case of NCGS. And I had because she's a villager, she cannot spend much. What I am charging her is a very normal fees. So in that case, when the patient is responding, so I thought it's better not to go for much tests. Any other questions? Actually, I basically stated this case only because it was a very recent case and she was a very honest lady. So it was very much okay for me to utilize this case. I have other number of cases as well where I have a number of reports that I'll be showing you further when we'll be having any webinar or anything as well.
Definitely, doctor. I hope that there's a continued webinar series and interaction about the same. Uh, we have our Facebook live also, where Sejal Shah had asked, what are the scope of homeopathic medicines in case of gluten sensitivity test positive?
So again, like you answered, it's
Ma'am, if a patient is if a patient usually is considered positive for gluten sensitivity, then we should understand it is the physical sensitivity of the patient. We'll have to analyze the physical as well as the mental sensitivity before prescribing. If you are able to diagnose that well in the homeopathic way, then whatever medicines you are prescribing, you will be prescribing for that idiosyncratic behavior of the patient. And if you are analyzing it properly miasmatically, or since I'm a teacher of repertory, so what I usually do is I analyze that miasmatic part through the repertorization medicines. So whenever I have a repertorization chart in front of me and I see that yes, a psychotic or a psychosyphilitic or a syphilitic miasm is dominant, I usually prescribe the highest of those anti-miasmatic remedies, and it helps. Till date, I'll be fingers crossed. Till date, it has helped and it is helping. Any other questions?
any other questions, chat? Did you say what potency or Merxol?
Okay, Dr. Linda. Actually, what I used was millisimal scale. I utilized Merxol from 0/1 to 0/2, 0/3, then 0/6, 0/12, 0/24, 0/30, and now she is on 0/60, which is prescribed to her once in 15 days.
That's lovely.
I hope I have made myself clear through this webinar, although I am not a perfect guy. So, Dr. Khan, please, I apologize if I am not absolutely correct. But, sir, if I'm trying to treat a patient, I usually keep aside a number of things. What my main concern is to help the patient. What my main concern is to get results from the patient.
Jan has said that I'm concerned about the continuation of the GMO wheat.
No, ma'am, you cannot question upon the quality of wheat which is being produced in a country or the other. But yes, if the sensitivity of the patient is high, then any kind of wheat is going to make her sensitive to a number of symptoms. So what all you can do is all you can do is to help the patient from getting out of that sensitivity.
Definitely. Doctor, apart from it being a staple food or it being that, like you mentioned in the case that she was producing wheat, she was a farming lady, and then that is the only reason that there was inclusion. Is there any other particular reason that we have to, include wheat as, getting back to it,
Okay,
or
ma'am.
it's just,
Let's take it this way. It depends. Okay, now as okay. First, I'll answer Dr. Rishmika. The point is, if you talk about northern India, our eating habits are in a way that we are usually tend to have meat in wheat. We are usually tend to have wheat in our diet once or twice in a day. If you talk about me, my normal diet is about 4 to 5 chapatis once in a time, and I take those chapatis twice a day. This is my very normal diet. So we are prone to having and we consider wheat as one of the most staple foods. If you talk about me, my hunger is never enquished if I'm not having chapatis in my diet. And considering rice, right, don't take rice much often because we consider it to be having so much of carbohydrates. It is considered to be one of the leading agents of weight gain. So what we usually take is wheat normal times. So we'll have to analyze in a patient ki how are we going to treat this patient? What can be the other sources? What I usually advised her apart from wheat was barley, because barley was also available to her. So I asked her to take barley, to take jaw or chana. So there were a number of flours available as per what she was going in her fields. So as per the availability, I had to advise her a number of things.
so, my another question was about the miasm, but I will address Dr. Professor Akhilesh Khan's question first. When totality is your guide, so no question failure. Keep it up. Okay, he's not asked a question. He's congratulated you for.
Thank you, Dr. Khan. And sir, basically, I'm just an assistant professor right now, but I'm more a clinician in a way. So my basic, what I focus is on getting the results. How you get it is more important, and what is more important is you should give results, because homeopathy is such a science in nowadays that people are questioning you round and round again and again about whether homeopathy is placebo science or not. You cannot give evidence based results every time. You have a number of things to show, but if you are giving results, then those are your patients. Those patients, those treated patients, those results which you have given to patients are your actual treasure. They are going to answer those questions which are saying that homeopathy is a placebo science.
Well said, well said.
So the cure is not necessary. Dr. Jan said, so the cure is not necessarily permanent. Ma'am, if she is still under my treatment, she is around, as per her husband and as per me, she is more than 70% better. And I feel, if you are talking about cure, I have not at all in any way suppressed her symptoms. I have only tried to ameliorate them, and they are ameliorating slowly and gradually. So if you talk about me, I have seen so many patients of NCGS. As I have experience with those patients, I have seen cure occurs, but the point is you can only treat those patients up to a level of 80-85%, because after that it all matters on the maintaining cause. What you can cure is basically dependent in these patients as per the questions of maintaining cause. So you don't have any authority over that maintaining cause. If you are treating a patient in a way, and if the patient has responded till 85% in your clinic, that means the patient is quite well. Now, the maintaining cause can never be in a physician's hand.
Very true. As you said, even ailment from is the key to any case. So causation is, very important that it takes us to
Yeah, exactly.
conclusion itself.
It basically a number of times there are two or three things which obviously helps you to guide to a main remedy. One is ailments from, and another is the causation, right? So if you have the causation, if you have the ailments from, then it can easily guide you to a number of
Yes.
remedies.
Yes, very true, very true. I really hope that you publish a paper on the miasmatic evaluation that you have done. I think that's something which is very
Surely,
questioning
ma'am.
of any.
I'm trying to publish a paper accordingly.
I was very astonished that it was more of Sora. I mean, it was more of psychosis and syphilis and not Sora, or Sora being in the background, like Sora syphilitic or Soro
Yeah,
psychotic or
yeah,
not
yeah.
that. It's just completely Sora
Ma'am,
psychotic.
sir, let me make one thing again clear.
Yes.
As per the ICMR records, if you are treating NCGS in India, then NCGS is different in different parts of the country. The rate is very much different. Right? In southern parts, it is really less, and in northern parts, it is really high.
Yes.
What we are seeing, as I stated in my presentation as well, it is 1 in 200, or it is about 1.23% in Indian population in northern India. So you see, it is very much difficult to treat all those cases every time.
Very true. Very true. Very true. Yes, of course, the maintaining cause is out of our control. The GMO wheat is a great problem
Right,
for
exactly,
these
exactly.
big agro companies. Very
This
true.
is this is the synthetic hexaploid wheat in India, which is causing the major complaint.
Very true. Linda has asked, clear the miasm. Did you say how you use the miasmatic remedies, potency and frequency? I had been away for the same lessons.
Okay, ma'am. Let me tell you again and again once more. I utilize, since the case was found to be psychotic. What I prescribed was Thuja 1M, and then that Thuja 1M. Okay, let me come to the slide this time in order to make Dr. Linda clear. Ma'am, can I use this share screen?
Yeah, yeah, yeah. Sure, please.
Okay, okay. Just a moment, please. Okay. So, Dr. Linda, this is for you. That the first prescription was Thuja occidentalis 1M. Three doses were given in a 1 hourly interval in 300 ml of water. That means one dose was given in one glass of water, and that was repeated 1 hourly on the single day. And then a combination was given. So this was how I prescribed the anti-miasmatic remedy. Okay, so I feel like I have answered maximum of questions.
Yes,
Dr.
definitely,
Rashmika,
definitely, Doctor.
I again
Definitely.
apologize if I was not so true homeopath while prescribing, but I'm really sorry. My main aim is to give results every time whenever a patient is in my clinic.
And yes, doctor, definitely. I mean, not at all. Your the webinar was a wonderful webinar. I think you've cleared the basics. I think the basics of whatever we study is very important. You've cleared the, the types of this thing, be it the diploid, tetraploid, or hexaploid. It's become very clear. It's become you've broken down into a very simple language that we'll understand what's the crux of it before going to seeing a patient or before going to a remedy. I think we need to understand the crux of what the problem is, and I think you've cleared that doubt, in a very wonderful way to us today, and that goes a long way.
Okay, no, no
Thank you so
problem,
much.
surely. Thank you so much, everyone, and thank you so much for being a patient listener. And a special thanks to Dr. Khan. I'll again try to read out the miasms once again.
Thank you so much. Thank you so much, Doctor. Thank you so much, everyone, for joining us today. I hope it's been a useful webinar for everyone. I hope everyone takes the same knowledge of, be it prescription or evaluation or rubric analyzing or materia medica, whatever we learned today, to your practice, and give us your feedback also. You can write to Dr. Chakshu directly, or you can write to us, and I would definitely deliver the message to Dr. Chakshu. Thank you so much, Doctor.
Thank
Thank you
you
so
so
much
much,
for joining.
everyone. Thank you so much,
Yes,
everyone. I'll be sharing you my mail ID if in case there are
yes, yes,
any questions of anyone. So I'll be sharing my mail ID in the chat box.
yes, yes, doctor.
Okay, so this is my mail ID, everyone. If in case you have any doubts, you have any questions, if in any case I can help you in any way, I'll be happy to help. Like we were discussing a case, I was discussing a case with Dr. Rashmika, and I hope I have helped
Yes,
her.
yes, definitely, doctor. I still not have the had the patient come back again. Like I said, I've already prescribed him arsenic. Arsenic iode 0 bar 3 actually. I've started with 0 bar 3, and he's taking it already. So hopefully he'll be coming back this weekend.
So
So waiting for that to happen.
surely, surely. Thank you so much,
Thank you
everyone.
so
Thank you
much.
for being a patient listener. Thank you, Dr. Rashmika, for hosting the webinar.
Thank you so much. Thank you so much.
Thank you,
Have a
ma'am.
good night. Have a good
Thank
night,
you. Good night,
everyone.
everyone. Thank you.